Good afternoon, and today's topic is corneal ulcer. We've already discussed bacterial corneal ulcer. Today we will be discussing on fungal and protozoal corneal ulcer. The commonest protozoa that causes an ulcer is Acanthamoeba as far as the eye is concerned. So fungal corneal ulcer is caused either by an yeast or filamentous fungi. Yeast commonly Candida and Cryptococcus, and filamentous fungi can be septate, aseptate or dimorphic fungi. The reason for this classification being given is, although it appears a microbiological classification, we need to know what is common in the eye. Amongst all this, Candida, Aspergillus and Fusarium are the commonest causes of corneal ulcer. Mucor can also affect the eye, but it does not cause corneal ulcer. Instead, it causes more of orbital involvement. Predisposing factors that can lead to a corneal ulcer are most commonly injury with vegetative material. Any trauma due to vegetative material can result in organic products that go into the eye and can result in harboring an infection. But it is also important for us to know that the most common kind of people who come to us with fungal corneal ulcers are people who work with, especially farmers or people who work in fields, and even those who are dealing with material packing. All of them are kind of prone to injury with vegetative material. Apart from this, pets, injury with animal tail and fur, and immunosuppression is another very important cause. Immunosuppression may be due to drugs such as corticosteroids or immunosuppressive agents, which is used in many conditions of autoimmune disease such as rheumatoid arthritis or patients who have non-infectious type of involvement, rheumatoid arthritis, juvenile idiopathic arthritis, or kidney problems, so many conditions in the body. Systemic diseases such as diabetes, HIV, and also local diseases in the eye can predispose to fungal corneal ulcers such as dry eye, herpetic keratitis, bullous keratopathy. So, an injudicious use of topical antibiotics is also one of the emerging very common causes of fungal corneal ulcers. The signs are depicted in this photograph. So, the most common appearance is that of a grayish white ulcer, and in a filamentous fungal infection such as Aspergillus, you will see, or Fusarium, you see this kind of a grayish white ulcer. You can observe that there is a lot of infiltration and it usually has a dry appearance, and these are pathognomic, these feathery elevated margins. These feathery elevated margins are pathognomic of a fungal corneal ulcer. And we also have this immune ring. If you can actually see, this is the immune ring. And this immune ring that is present usually indicates the presence of an antigen-antibody reaction. And antigen-antibody reaction has caused the deposition of immune complexes at this junction. This is one of the typical features of a corneal ulcer. And we also have what you call satellite lesions. So these are the satellite lesions. These areas that are away from the ulcer, and individual lesions are called satellite lesions. Again, one of the pathognomic features of fungal corneal ulcer. A hypopyon, like you're seeing in this picture. So, hypopyon in a bacterial corneal ulcer, I told you, is usually a sterile hypopyon. So, sterile hypopyon means patients will have pouring and exudation of white blood cells, and that will settle down in the inferior angle of the anterior chamber, and it is called a hypopyon in bacterial corneal ulcer. But in today's class, we're talking about a fungal corneal ulcer, and in these patients, you will have the presence of fibrin in the angle of the anterior chamber, and it is not a sterile hypopyon. It can occur because of invasion of fungal filaments. So, which brings us to the important point that in patients with a fungal corneal ulcer, the many layers of the cornea, the deeper layers of the cornea can get involved, and you can have in the later stages what you call an endothelial plaque. And entry into the anterior chamber is quite easy because these filaments have reached up to the endothelial layer of the cornea. The fungal ulcer is typically associated with pigmentation in patients with demataceous fungi such as Curvularia or Cladosporium. And all this picture that I put up is very typical of a fungal corneal ulcer, which is due to a filamentous fungus. Whereas in patients with a Candida, that is yeast fungal corneal ulcer, usually you do not have this appearance. Instead, you'll have a collar button appearance, that is a yellowish or whitish collar button kind of appearance without these typical feathery elevated margins.